Hello and welcome. Today, we'll be exploring a disease that has plagued humanity for centuries, tuberculosis, specifically pulmonary tuberculosis, affecting the lungs. Join us as we delve into its causes, effects, and what we can do to combat this persistent illness. Pulmonary tuberculosis, or TB, is primarily caused by a bacterium called Mycobacterium tuberculosis. These bacteria spread through the air when a person with active TB disease coughs, speaks, or sings. When someone inhales these droplets, the bacteria can reach the lungs and initiate an infection. While anyone can be infected, certain factors, such as weakened immune systems, close contact with infected individuals, and living in areas with high TB prevalence, significantly increase the risk. Once the Mycobacterium tuberculosis bacteria enter the lungs, they are engulfed by immune cells called macrophages. In many cases, the immune system is able to contain the infection, forming a granuloma, a cluster of immune cells that wall off the bacteria. This is known as latent TB infection. However, if the immune system is weakened or overwhelmed, the bacteria can escape the granuloma and begin to multiply. This leads to active TB disease. The bacteria damage lung tissue, creating cavities and inflammation. This active infection can then spread to other parts of the body through the bloodstream or lymphatic system. Tuberculosis remains a significant global health concern, particularly in low- and middle-income countries. The World Health Organization estimates that millions of people develop TB each year, and it is a leading cause of death from infectious diseases. Factors contributing to its prevalence include poverty, overcrowding, malnutrition, HIV/AIDS, and limited access to health care. While TB rates have been declining in some regions, challenges remain in controlling its spread and preventing drug-resistant strains from emerging. The symptoms of pulmonary TB can vary depending on the stage of infection and the individual's overall health. Common symptoms include a persistent cough that lasts for 3 or more weeks, often producing phlegm or blood. Other symptoms may include chest pain, weakness or fatigue, weight loss, loss of appetite, chills, fever, and night sweats. It's important to note that some people with latent TB infection may not experience any symptoms at all. If you experience any of these symptoms, especially a persistent cough with blood, it's crucial to seek medical attention promptly. Diagnosing pulmonary TB typically involves a combination of tests and assessments. A tuberculin skin test (TST), also known as the Mantoux test, or a blood test like the interferon gamma release assay (IGR), can determine if someone has been infected with TB bacteria. If either test is positive, further testing is needed to confirm active TB disease. This usually includes a chest X-ray to look for abnormalities in the lungs, and a sputum test to identify the presence of Mycobacterium tuberculosis bacteria. In some cases, a bronchoscopy, where a thin tube with a camera is inserted into the airways, may be performed to obtain a sample for testing. Pulmonary TB can be broadly classified as either latent TB infection or active TB disease. Latent TB infection means that the bacteria are present in the body but are inactive and not causing symptoms. People with latent TB are not infectious. Active TB disease, on the other hand, means that the bacteria are multiplying and causing symptoms. People with active TB disease are infectious and can spread the bacteria to others. Treatment for pulmonary TB typically involves a course of antibiotics, usually a combination of several drugs, taken for 6 to 9 months. It's crucial to adhere strictly to the prescribed medication regimen and complete the full course of treatment, even if you start feeling better. This helps ensure that all the bacteria are killed and prevents the development of drug-resistant TB. Directly observed therapy, or DOT, where a healthcare worker observes the patient taking their medication, is often used to improve adherence. In cases of drug-resistant TB, more complex and longer treatment regimens are required, often involving second-line drugs with potentially more side effects. Preventing the spread of TB involves a multi-pronged approach. Vaccination with the BCG vaccine, although not universally effective, can provide some protection against severe forms of TB in children. Early detection and treatment of active TB cases are crucial to prevent transmission. Screening high-risk individuals, such as those with HIV or close contacts of active TB cases, can help identify and treat latent TB infection before it progresses to active disease. Improving living conditions, reducing poverty, and promoting good nutrition can also help strengthen immune systems and reduce the risk of TB infection. Effective infection control measures in healthcare settings are also essential to prevent the spread of TB. The prognosis for pulmonary TB is generally good with prompt and appropriate treatment. Most people who complete the full course of antibiotics are cured of the disease. However, untreated TB can be fatal. Drug-resistant TB presents a greater challenge, requiring longer and more complex treatment regimens. Ongoing research is focused on developing new and more effective drugs, shorter treatment regimens, and improved diagnostic tools. Scientists are also exploring new vaccine candidates to provide better protection against TB. The fight against tuberculosis continues, with the hope of ultimately eradicating this ancient disease.